A surge in COVID-19 cases driven by the Omicron variant has been disrupting holiday travel plans all across the world. Thousands of flights have been cancelled globally because of the impact of the coronavirus on airline employees and on passengers. Despite this, people are trying their best to maintain the Christmas spirit.
'Twas the night before Christmas. But instead of the usual last-minute Christmas rush, the streets here in London have fallen silent. The UK broke their record of COVID cases for the third day in a row, recording about 122,000 infections. Numbers have climbed so high that some estimates predict 1 in 10 Londoners have the infection. The surge in cases has dampened the Christmas cheer and left many industries struggling with staff shortages as sick workers are forced to isolate. It's a problem that has hit airlines particularly hard. Flights around the world had to be cancelled on Christmas Eve, adding another layer of stress to people's already precarious holiday plans.
We were really concerned last night when I saw on the news that they had canceled 100 flights, and I'm like, oh my God, we won't be able to get home. But luckily, we kept checking the flight status, got here, and everything was fine. So we were really grateful for that.
In Spain, you don't have to be travelling far to face disruptions to everyday life. Just stepping outside your front door now means having to wear a mask. The Prime Minister announced the decision after 2 consecutive records in daily cases. It's come as an unwelcome surprise to many. When we got off the train and I saw everyone wearing their mask, I remembered that it was the first day of the mandate, and I thought, what a drag, again with the mask. It's a bit suffocating, a bit claustrophobic. I'm not very happy.
No estoy muy contenta con la nueva.
Though it may not be the COVID-free Christmas that so many had hoped for, people are doing their best to make sure some of the festive spirit remains.
Let's get more from Peter Chen Hong. He's a professor of medicine at the University of California in San Francisco. Professor, welcome back to DW. It's nice to see you. Omicron is turning out to be far more infectious. What is the knock-on effect in terms of the sheer scale? Can we expect that everyone across the world perhaps is going to come in contact, and not just come in contact, but actually contract this virus in the coming weeks and months?
Well, that's what some people are thinking, Rebecca, that it's so transmissible, up to 4 times as much as Delta, that it will be hard to escape. But nevertheless, I think we could try to mitigate damage, and we're most worried about unvaccinated folks and folks with comorbid conditions. It's still going to result in a lot of hospitalizations, even though it's probably less, severe to the general person as Delta was.
You mentioned vaccines there, but studies just released in the last few days show that vaccines are to be much less efficient than previous variants, with one relatively large study in the UK suggesting even with a booster, you're only really protected for around 2 months. What do you say to that? What does that mean for people?
Well, it all depends what our goalpost is. If your goalpost is prevention of infection, then sure, you can look at the vaccines and say 2 doses, 20, 30%. A booster probably doesn't give you much more, and not for that long. But if you look at the outcome of serious disease, hospitalization, and death, the vaccines are really spectacular at that. And as an infectious disease doctor, if you told me I had a choice between just preventing infection or serious disease, I'll choose serious disease anytime.
Absolutely. Does that mean then that we're going to be having booster shots every couple of months?
Well, again, it comes back to what our goal in society is. So I can give you all the science and tell you that this vaccine or booster might only last 10 weeks before it wanes in efficacy against infection. But if we reevaluate and think that we were thinking mainly of hospital capacity and the ability of hospitals to, take care of sick people, then maybe after, at some point, we'll be able to accept that, with 3 doses, maybe we'll be good enough with prevention of people going to the ICU are dying, and we'll accept a certain amount of disease in society.
I'm sure everyone certainly hopes so. Professor Peter Ching-Hong in San Francisco, thanks very much for your time. Merry Christmas.
Merry Christmas, Rebecca. Thank you.
Well, many of Europe's hospitals are once again being stretched to their limits and staff are more burnt out than ever. Despite that, they're still trying to bring some joy to patients spending Christmas on the wards. DW's Christine Mundwa reports from Liège.
'Tis the season, but much of the jolly has gone. There are more masks than Santa hats. Another year, another variant, another COVID Christmas. At this hospital in the Belgian city of Liège, vaccines mean it's better this time around, but they're not sure how long that will last. This time last year, this hospital was overwhelmed with COVID-19 patients. It got so bad, some of the ICU patients had to be airlifted to neighboring Germany. The situation is under control for now, but the staff here are bracing for Omicron. This is the COVID ward, and staff here are hoping for the best, but they're preparing for the worst and keeping a nervous eye on Omicron infection numbers.
We are hoping that it won't be too strong because we know also that we don't have all the staff we would need if it was very, very big, and we will do our best.
Health workers have had a grueling couple of years. The hospital psychologist says the uncertainty is making it difficult to cope.
I don't see that people, the nurses or doctors, are afraid. They're more anxious that this might go on forever, that this repetition just won't stop, because in the end, one variant chases the last, and it comes in waves, which is very exhausting.
Tired as they are, nursing staff will, as they always do, try to lift the spirits of those in hospital this Christmas. But that's particularly tricky with COVID patients. They're isolated and can't have visitors. But there will be a special surprise on Christmas morning.
We have some kids who are writing some cards every year, but since I'm here, since years and years, they're writing little cards for people. And the morning of Christmas, we put the card on the plateau, the meal, with the meal, and they get it, and they have a little card saying, "Hello, I think about you."
Staff have created an oasis of calm and care here, but they know it probably won't last long. Outside, infections are spreading fast.